On behalf of the American Academy of Neurology and in collaboration with Neurology Today, it gives me great pleasure to introduce Dr. Nicholas Johnson. Nick is the chair of the American Academy of Neurology Advocacy Committee and has been very busy lately, I'll put it that way. But also he's vice chair of research and associate professor of neurology at Virginia Commonwealth University. Nick, I've been following COVID-19 from the science, from the administration, but from an advocacy and a policy perspective, the AAN has been very busy. It seems like every couple of days I see something else. I'm writing a letter to this person, this agency. If you could just start off by giving our members just an overall gestalt about what the AAN has been doing and really what you've been up to in the last several weeks.
Yeah, great. Thanks. And thanks for taking the time today. I think you're correct. In my years at the AAN Advocacy Committee, and certainly in our past staff members' memories, we've never seen anything like this in terms of an unparalleled response on behalf of physicians to advocate for them to basically improve the quality of their health, keep our workforce sustainable, and then obviously advocate on behalf of our patients' neurological disease. So, in broad strokes, we have issued at least four comment letters, and those comment letters have gone to places that we don't typically send comment letters to. By way of background, the AAN advocacy arm is often very active in terms of legislative advocacy, and also with CMS, or Center for Medicare and Medicaid Services. But we're sending letters to Vice President Pence and his COVID-19 task force in the executive branch, which is highly unusual for us. So four comment letters that we have authored personally, and then additional 9 comment letters that we've signed on to from large coalitions, AMA, ACP, even American Epilepsy Society. And the content of those comment letters in our advocacy is crossing lots of boundaries, again, that we don't typically go to. So first and foremost, we've issued or signed on to a number of comment letters that really speak to personal protective equipment, or the ability of providers to have adequate protective equipment when they're engaged in seeing patients, particularly those either with COVID-19 or persons of interest. So we've certainly been advocating heavily on that regard. Also, kind of in the same vein, advocating the need for additional ventilators in areas of that are experiencing the surge. So again, lots of activity about both our well-being, also patients' health and well-being in the setting of this pandemic. Some of the most interesting advocacy and a large focus for us has been in and around telehealth. So one of the things that so-called silver lining as part of this COVID-19 pandemic is this idea that we are able to reduce or relax a lot of red tape. I know many of you who are seeing patients via Zoom or even FaceTime or other things have been appreciative in some ways that, this is a new way to practice medicine. So in terms of telehealth, that advocacy has been to allow parity in terms of E&M billing with an in-person visit, which has been accomplished, and that's been really, I hope, at least a bright spot and otherwise kind of difficult time. Advocating for telephone visits. There's been letters that have discussed relaxing the HIPAA and requirements, other letters that speak to the relaxation of prior authorization requirements. So again, just overall kind of a really reduction in the amount of red tape and hassle that you've been experiencing for a number of years as a neurologist in practice. Other points of those comment letters talk about workforce. So one of the big issues has been the financial viability of many practices, and encouraging a number of different steps that have spoken to that issue. And at the same token, in terms of workforce, the GME issue. So allowing our new neurology residents to have visa waivers that allow them to, or not visa waivers, but visas that allow them to start the residencies on time, and also speaking to waivers on the back end so that we might allow some of our graduating residents to stay for longer than what they might anticipate. And finally, speaking to issues in terms of research in the coronavirus area. So it's a very expansive area, lots of activity.
Yeah, I mean, for practitioners out there, the majority of our AAN members are, got their boots on the ground in practice and clinical practice. And I mean, there's so many aspects of this disease pandemic situation that are tough, and there's the front lines toughness, which we're enduring now in different cities and then, kind of a rolling crest of waves throughout the country. But the medium term is what I worry about with, financial viability, sustainability, and, we're losing. I mean, we're in an academic medical center. We have some insulation in some ways, but we are losing money every day, like just not trivial amounts of money that you just can't make up, from one day to the next. And in practice, when the margins are potentially even a lot thinner and you have even less, backup, and it's, the Paycheck Protection Program and the federal options out there, small business loans. I mean, those are helpful, but it's just not going to make up the vast chasm of loss of money. So I agree with you, and just first of all, thank you for doing this. It's like we're not doing some of our day job activities, but now we have like family extra activities, and then we have these activities which have really literally taken up not just a few hours, but tens and probably 100 hours of time or more by getting this out there. Getting reimbursements for telemedicine, great. We can now talk on the phone and bill for it, but you get like, I don't know, $40, something like that.
Yeah, it's not enough.
Yeah. Exactly. So we're making progress, and I'm happy. Keep up the good work. Amazing job. But I hope this leads to a major transformational change. You said about prior auths, like seriously already, like, about documentation. Okay, documentation is important, but some of these rules are just so, anyway, I'll keep my personal opinion out of it. But, the fact that we can hopefully start practicing neurology in the 21st century and be treated like neurologists practicing in the 21st century, the time has come, hopefully.
That's right.
Do you think that these changes, for example, practicing across state lines in some aspects, the billing aspects, the telemedicine aspects, do you think these changes are sustainable? And what I mean by that, I guess, is twofold. Is it sustainable from a policy perspective and like a federal perspective, a state perspective? And then do you think these changes are here to stay because our physicians want to continue with practicing this way when appropriate, of course?
Yeah, I think those are really good questions. And the first thing you should know is that the AAN is definitely trying to think post-COVID, post-pandemic about what does practice look like. I think that planning includes multiple different steps, right? So one of the most important things to do, and something that we're continuing to advocate for, is additional financial support particularly for those in smaller or solo practices, because the financial losses associated with this pandemic are likely to be significant, and we're aware of that. And certainly recognize that the steps that have taken so far, they probably help, but certainly not to the extent that they need to. And so we are anticipating and expecting that in a fourth congressional package, that we might have another opportunity to improve that financial relief. But I think all that being said, it's possible that post-COVID practices may include more telehealth, may include more, I think myself included, a lot of us are using this for the first time and saying, hey, this is not so bad. I could probably do some of it. That doesn't equate for allowing us to take care of the brick and mortar costs that a lot of practices retain. But the Academy is put together a collaboration in the Center for Health Policy that includes the Advocacy Committee, the Quality Committee, and then the Medical Economics and Practice Committee to start to envision, how best can we support our members and their practices post COVID-19. Do we encourage more practices to move, like I said, to a more telehealth environment? Mm-hmm. On the legislative and regulatory side, we are absolutely using this time to say, hey, look, you've relaxed this prior authorization requirements and we haven't run rampant. There's not a lot of excess IVIG that's being prescribed and other prescriptions. It turns out we can probably police ourselves to some extent. So we are absolutely advocating where possible that, the steps that they've taken temporarily to reduce these regulatory hassles, that they put those in place. And I think there's a real argument to be made that's likely to be true. Probably the biggest challenge will be in reimbursement for telehealth, because that's an area where, as you said, and I've said before, that, we've certainly gotten some steps to cover some of those financial or for some financial benefits as it relates in terms of parity and that kind of thing. But, those are set to expire. And so we are working vigorously, particularly using the AAN's Axon registry and other tools at our disposal to collect data where possible to say, hey, look, this is, again, this is a viable approach. It doesn't cost a tremendous, it's not, the concern around telehealth has always been that there would be additional costs that would be accrued. People would see their doctors more frequently. New people would enter the healthcare system. And to the extent that we're able to show that that's not the case, that this really is a one-for-one replacement where possible, we think we have a real opportunity to cement some of those gains that we've made in terms of payment for telehealth. State licensure is another issue. That's a different question. I think that's going to be on the state level, and that will be very challenging, I think, to relax that or bring that back, I should say.
Yeah. So this, the state licensure stuff, I don't want to, it's always been confusing to me that the regulations for each state, I mean, I understand separation between federal and state, and I get all that, and I don't not support it or anything. I'm just, I'm agnostic about that. But I mean, it kind of brings up a point, like if we need doctors to practice here, but we have more doctors here,
Right.
What is the magic, telehealth can practice, why can't you practice across state lines? I understand there's lots of trickiness, but I don't know, do you think there's going to be sustained potential changes with practicing across state lines with telemedicine, or you think that's probably the hardest rock to move or needle to move?
I think that'll be among that. So the financial compensation by far and away is going to be the biggest hurdle, and preventing the rollback there. But I think second among that is that kind of, a national medical license, for example, which has been in more conversations recently than has in the past decade. And so that's really the step that has to happen, because if you're, there have been, in terms of interstate licensure, you really need all 50 states to agree at that point, and that becomes a very tricky process. So I imagine that will be a big hurdle, but it's possible that it's you may see kind of regional networks form first. Is how I'd expect to see it.
Oh, that would be great. Yeah. I mean, the tri-state area of New York, for example, New York, New Jersey, and Connecticut, we've kind of been functioning as one shared decision-making in a lot of aspects. Independence, states' rights and independence, of course, but all coming together and trying to work together. So I agree.
Yeah, that makes sense to me. So
that's great. Okay, so probably the most, well, I don't know if it's the most important question, but I think it's on the top of the mind of many of our AAN members. What can our members do? There's a lot going on. You and your team have been doing a lot, immense amounts of work. There's these types of watershed moments for advocacy can really help to move the needle in the direction that I'll just be my, again, personal opinion. Doctors deserve to be treated in a way that rewards them for the sacrifices. Right. Whoever is pitching into this and like risking their own personal health and safety. I mean, we should be, treated in a fair way. And I think the only way to have those, things happen is to have members, especially dozens to hundreds to thousands of them, do something, write a letter. What can our members do? If someone watching this says, wow, this is great, I'm glad these things are moving, but man, if we had 1,000 more neurologists or
Right.
5,000 more AAN members pushing in this direction. I donate to, like, for example, the brain pack, for example. I
Right.
donate every year. I get my little pin. Glenn Finney, it's his fault. He gets me every year at the AAN meeting, and I do it. I've been increasing every year as best as I can do. So I try to do my own part in a little way. I'm interviewing you, but what can our members do who are at home? They may or may not have extra time. Hard to say. What are some things you suggest?
Yeah, I think that's the first thing to say is that we've received more comments and letters and other email messages from members in the past 3 to 4 weeks than I think we've seen in a long time. So first of all, keep it up. We want to hear what members are interested in. This is a very complex target, lots of quickly moving parts, and so always recognizing the fact that there's maybe something that we missed, or that have you guys said about this. And so certainly feel free to reach out to me or the rest of the AAN advocacy team about issues or concerns that you have, and we'll try and incorporate that as best we can. So on the AAN Advocacy Center, there you can click a link. You can read all the letters that we've provided so far, including the one that will be going out this week to Congress about the next congressional step. And so there's actually a lot of information there about what the Academy thinks is important, including things like hazard pay. We've talked about or advocate for hazard pay and additional kind of malpractice relief. Thanks for bringing that up. Because of what people are being asked to do in surge areas. So I think then beyond that, what can you do? We tried to make this as simple as possible. You can go to Vocus. You can share your story with us. It's always helpful for the Academy to have kind of personal anecdotes about kind of what you're seeing. And then also you can directly write to your member of Congress using some of you can certainly use the letters that we've sent to congressional leadership, for those right onto your member of Congress, so that they can see that you're thinking about that specifically. Congress, by the same token, is interested in hearing from their constituents. They recognize that this is a big deal. A lot of members of Congress want to take action. They need to be, we need to help them understand what's important to do. So, for neurologists and for patients with neurological disease. So that's probably the most important thing that I can say. Go to the AAN Advocacy Center, look at the letters, and then also, feel free to use that Vocus tool to write to members of Congress using that letter as a draft. So,
and that tool it's an online tool. Just explain that just a little bit.
You click in if you're logged into the AAN.com website as the member. It'll pre-populate, knows who your members of Congress are. So it's about 3 clicks. So you click through the Vocus and then click who you want to send it to and push send. So super
Perfect.
Easy.
Great. So just to recap, really important, if someone wants to do something right now after watching this video, go to AAN.com, log in using your member ID, and then you can literally pre-populate. That's perfect. That's awesome. That's helpful.
Yeah.
And I forget who I was in a conversation with. I did neurology on the Hill a few times back when I was a resident, and then back when I was a more junior faculty. And I forget who told me this, and maybe this isn't accurate, or I would love to get your input. But I guess I think I said, well, writing one letter, one email, how much is that going to do? And the person I was talking to said, yeah, but if you're writing that letter, it's like thousands of people are probably thinking that. So it can do something. And it's not just going to be you, it's going to be other people too. So I do think even one letter from hundreds or thousands of us I think do a lot. I guess you'd agree with that.
Yeah, no, I think, traditionally what happens, these letters is that they get received by the congressional office. They go in a mail count. So that the member of Congress every week has information about what their constituents are writing to them about. Usually it's a tally. This situation is different. I think, like I said, many members of Congress are attuned to this. They're paying attention to it. They're trying to figure out how to help. And so I think there's a lot more attention being paid to these letters. So send them in.
Perfect. Nick, Dr. Johnson, pleasure. Really
Oh,
enjoyed the chat, and thanks for all you're doing. We got to keep pushing things forward, and we need advocacy. So we all appreciate you.
yes, thank you. Yeah, you too.
Cool. Okay, take care. Bye bye.